We're going to continue our morning session and bring to the stage panelists that are going to discuss about consumer interaction, inclination, and personalization of wellness products and services. So without any further ado, Dr. Noreen, I'm going to invite you up to the stage so you can please, founder and medical director, What the Doctor Recommends, introduce your panelists, if you don't mind.
Cool. Of course, thank you. Great. Hello. Okay. So we need to get the energy up in this room because we have such an exciting panel coming to you today with these amazing thought leaders. So everyone on my right, give me a little Mexican wave. Okay, and now everyone on the right, give me a little Mexican wave. There we go. Cool, so you're engaged with us. So we have an exciting discussion this morning covering the drive towards customers and consumers, their buying habits and how they're buying into wellness, especially post-pandemic. We're going to talk about these emerging trends and these shifting health consciousness and really dissect how customers are investing into personalized wellness products and services. So, without further ado, help me to welcome up Yasemin, CEO and founder of Uniqgene. And we've got Dr. Broennimann, Group CEO of Dynalis, Pharma Limited. And we have Asma Labidi, CEO of SKINIMALIST. Dr. Konrad, founder of Biolytica. And last but no means least, we've got Thiviyah, Raman, founder and CEO of Happy Days Collective. Amazing. Hello, hello. Okay, good. Okay, we're just getting situated.
Yeah, we'll give the mic a second.
Okay. So, one of the first things that we thought would be really great to do is to kind of give the audience a 60-second elevator pitch about what you're doing, what you're bringing to the table in terms of personalized wellness. We can start with Thiviyah.
Hi. Hi, everyone. My name is Thiviyah. I'm from Singapore. I am actually the founder of Happy Days Collective. Maybe I'll start with why I got into this. I am actually a psychotherapist, a yoga teacher, holistic wellness coach, and an astrologer as well. So my journey towards mental health actually started when I was very young. I went through a traumatic incident when I was really young. So going through that personal grief actually made me search for a lot more deeper things in life, more on how to overcome my own personal grief, how to help my family around it. And so that is really what inspired me to take action over my own mental health. And that's where I began my journey from a very young age. It took many years until I got a bit more professionally trained to even actually understand how to overcome certain traumatic incidents, how to go through difficulties, challenges in life. So I did my professional journey in America. I trained as a mental health counselor there, and I worked with a lot of clients. And going through all that experience taught me a lot and how to help people. But right before the pandemic, I actually moved back home to Singapore, and I realized there was a little bit of gap with how mental health was seen back in Asia. It was really different. Like the Western approach was very open to counseling and these practices, but in the East or back in my home country, there's still a big stigma related to going to see a therapist and going to therapy in general.
And so that's how you founded the Happy Days Collective. That's amazing. So I'm
Yes.
going to move on to Rob.
Sure.
So we are going to talk about wellness today, and we can't talk about wellness without talking about health. And we are not living in a healthcare system around the world, we're living in a sick care system. We wait for diseases to pop up for the most part. That's how the whole systems are set up to benefit and profit from it. But that's not sustainable. We can't move on globally with a sick care system. We need to move towards prevention, towards making sure that people stay healthy and stay healthy for as long as possible. And so what we do at Biolytica, the company that I co-founded in Switzerland, is we have developed a platform that allows us to support professionals like yourself, clinics, healthcare professionals, coaches, longevity physicians, to develop more personalized journeys around healthcare, around prevention, and around making people not get sick. And we do that by using the power of the amazing amount of data that we have available today. Genomics, pharmacogenomics, epigenetic testing, wearable devices that everyone is using, nutritional information. So these are all data points we can use. And so we've built a platform to combine all that and to provide a tool and to hopefully make sure people stay healthy for as long as possible.
Amazing. Asma?
Yeah, hi everyone. So basically I'm a pharmacist and a cosmetologist, and I have been a lobbyist for several years. I had the chance to be in direct contact with a lot of patients and consumers, and we have been talking about skincare and skin health, and I realized how much people need a customized journey regarding their skincare routines. And this is why within SKINIMALIST, we have decided to launch an AI/AR platform that gives you the tools to create your own skincare routine via an objective, scientifically proven skin analysis, and also providing you with the key recommendations for your skin problems based on your budget, on your location, and on your product preferences. So this is actually a game-changing solution, especially within the EMEA region. It's the first platform doing this, and we are really excited about the skin health journey with our customers.
Honestly, it sounds incredible, and we need to connect because I need my own
100%.
personalized AI system for. And what about you, Dr. Ben?
I'm Ben Broennimann. I'm from Switzerland and a trained surgeon. And I spent 25 years in medical devices and now in food supplements. I experienced myself personalized medicine. Is it working? I experienced myself personalized medicine in India where I fell sick years ago. And it was a real eye-opener for me to go into that direction. What we do at Dynalis Pharma is we develop a new concept of food supplements for slowing down aging and help people age healthy. That's what we do. What we do differently is we are focused on the different stages of life, on the different decades people go through, 20 to 30, 30 to 40, etc., etc. And this is a step to personalized medicine, and because we think that we cannot just jump from the medicine we do now to a fully personalized medicine. So we need to proceed in stages, and we want to be part of that stage and that journey.
Thank you so much for that. And now I'm really excited to hear about your company because you, probably more than any, you have epitomized personalization.
Yeah, of course. Hello, everyone. My name is Yasemin. I'm from Turkey. I'm a molecular biologist, and I'm studying in sports injuries in my master's degree. So as a part of molecular biologist, my other passion is sports. You know, like I've tried many kind of sports, and I was a professional former tennis player. And then I combined my passion with sports to find potential of the athletes and to produce solutions for the athletes for their better performance. And in that case, we have a company called Uniqgene, where we genetic test the athletes and the future generation and give them a personalized report about their muscle type, injuries, oxygen capacity, and that kind of stuff, which you can use in your daily lives. So I can say that I represent youth and future generation, and I'm so happy to be part of this conference, so I'm giving this to you.
Okay. Yes, I'd already spoken a little bit when I was up on the stage there, but I'm Dr. Noreen Nguru, founder of What the Doctor Recommends. Now, I am the world's first doctor to be combining medicine with travel, so I prescribe travel as medicine for the mind. I'll be talking a little bit later about what that actually means, but it really is my mission to train enough medics to be able to help 100,000 professionals detox from technology, recover their sense of well-being, their mind-body connection, and recover from burnout by 2024. And I'm currently working with the College of Medicine and Integrative Health in the UK to get wellness travel coaching and prescribed wellness travel actually recognized as a form of therapy and social prescribing. So that's what I do. What we'll now talk about is consumers and this kind of thought process of using health and wellness interchangeably. What do you think?
In my opinion, I think that people continue to do the amalgam between health and wellness today, because I think that health and wellness are the one and like the same thing. But this is why we are here today, like to talk more about the difference between health and wellness, and to say that health is actually part of wellness, but wellness is more complex and more holistic. And we need, like, health is a first step towards a well-being journey or a wellness journey, but it's not only health. You need to tackle so many other things. We talk about mindfulness, we talk about appearance, we talk about sleep, we talk about so many things that are important to our wellness, and it's very important to be able to tackle our health holistically, 360, and always get this vision regarding our health.
I think that's really pertinent what you just said, and did you want to jump in there, Thiviyah?
Is it? Oh, okay. It's not working. Yeah, I just like to add on to that about health and wellness, at least with regards to how I view it, is that health is a way for you to identify what you are feeling, what is happening to you at that state, in your current state of being. And wellness is actually like taking action to where you want to be, what you want to do. And in this journey, I think this whole idea of having a personalized experience is so important, because everyone's different, everyone's state of being is different, everyone's perception of what is good for them, what is good for their mental health, physical health, intellectual health, everything is to each its own. So in this whole idea, I think the first step is to actually identify your own state of being, whether it's through a doctor and a form of assessment, and then choosing what is right for you.
That's very true. And what do you think are some of the intrinsic and extrinsic factors that are affecting the consumer's inclination to basically purchase these personalized wellness products?
Yeah, sure. I just want to add a quick something, like whenever we talk about health, I just, a lot of people mention, okay, I'm not sick, but health is something more than that. It's also, like social, mental, and your physical stuff. But when you think about wellness, it's more like optimizing your health issues, and it starts with knowledge, I guess. So for the knowledge, you have to take, like personalized information. And when you get that knowledge, what do you do actually, right? Maybe you have opinions, you want to join me. But when you have that knowledge, actually you have to take some actions, right? And when you have like intrinsic factors like your age, your gender, your genetics, and you have some extrinsic factors, whenever you want to buy a supplement, like for example for wellness products, you just tend to ask people, right? Take some comments and take some feedbacks too, because there are a lot of products. And in that case, we need a lot of feedbacks, and for the personalization, you need to give some data. And in that case, I feel like, of course, like health is a must, but in that case, wellness could be also a must. And in that case, some extrinsic factors like, okay, health is wealth, like she said. And maybe in that case, we can actually, like companies, we are working more than that, maybe more than customers, consumers to make a better product. Maybe you have something to add, but there are a lot of factors and we both influence each other.
No, I completely agree with that. And I was going to say, so Rob and Ben, personalized medicine, also known as precision medicine, is the process of really individualizing and tailoring treatments and therapies to the individual. And now the International Consortium for Personalized Medicine have stated that personalized medicine should really be the next generation of healthcare by 2030. And so in your respective countries, would you say that your healthcare systems are set up in a way to achieve that goal?
I believe, at least in, I'm in Switzerland, I'm a Swiss citizen, and I can assure you, even with the best possible access to IT and financial means, Switzerland is by far in no way able to get to that point. Having said that, I think we need a paradigm shift. It's not all IT and data and mining and gathering personalized information from people which is going to solve the problem. Basically, there is no medical person, no medicine, no science that can beat your own body. And who is a better personalized physician than yourself? Your body knows what to do when you get sick. Your body knows what to do to prevent cancer cells from spreading in your body. The problem is, how long can he do that? And I think one goal of personalized medicine should be, rather than curing, it should be to prevent, but by helping the body to do his own job, which is maintaining you alive and healthy and able to run away from the lions. So basically, this is where this science or this goal of personalized medicine should aim for. I am, however, a little bit afraid that there is not enough money to do with that. So the interest of the big companies is probably not really churned by this. But we personally can do something about that, which is trying to go into that direction individually and maintaining ourselves healthy by also doing some research, by accessing to knowledge and trying to get to this knowledge on how to keep ourselves healthy.
So you're essentially the consumer taking the onus on themselves through us educating them so that they feel like there's a collaboration, so it's less of this paternalistic going to the doctor and that's it. It's taking that power back to themselves to make educated decisions about what they're buying into. True, and did you have something to add, Rob?
Yes, so I partly agree and I partly disagree with what you're saying. The part that I definitely agree with is it's very hard to make money from that at the stage, and also the whole system isn't set up to do so. And our company works globally, so we talk to a lot of people also in the healthcare systems, in the insurance systems. And one of the big issues is that, especially when we talk to insurance companies, they say, well, personalization is great, prevention is great, but we have no way to really measure it. We can calculate to the last digit after the comma what it's going to cost us if someone is going to be get a specific type of cancer, how likely it is that will happen. But if you tell someone to, and I agree with you in the part that you say, our body knows to heal itself best, if someone is moving more, if someone is eating more healthy, we don't know what this means 20 years down the line. We don't have the models to calculate it, so we can't support it. So essentially, there needs to be a shift, and the part where I disagree with Ben is that it's true that our body knows what it needs to heal and to stay healthy, but I think data can be a very important part of that, because you can only personalize if you really understand what it means for every one of you and every single person in the room, because every one of us has different needs in terms of exercise, movement, in terms of nutrition, in terms of mental health, in terms of other strategies. So I think understanding through data what it is for every person can be a very important factor about that.
I agree. I agree that there is an amount of data to be gathered to make informed decisions, scientific decisions. The problem with that data is like sitting at a poker table. If you at the poker table don't know who is the sucker, it's you. So the problem with the data is that when it's gathered, the sucker is you. And that's my problem with it. But no offense, it's a reality of life, but we need to be aware of it.
It's good to challenge what we think. So I feel like no offense taken. So just very quickly, we have about 3 minutes. What I would really love is to break down maybe one key business strategy that you are hoping to implement in 2023 to be able to offer more of a personalization to your products. So let's say me, for example, everything that I do is highly personalized to every single high net worth individual that I work with in terms of the wellness retreats, in terms of the corporate wellness programs that I design and the one-to-one prescribed wellness travel. But something that I would really want to do is to, as I said, train enough medics to be able to prescribe the prescribed wellness travel so that we're reaching different demographics. It's not just accessible to high net worth individuals, but everybody is burnt out. This is probably this poor sleep and burnout are the silent pandemics that we're going through at the moment. So that's something I'm doing to open up personalization to more people. So let's go down this way. What's one key strategy?
Yeah, sure. As you said, like at the beginning, we aim to provide personalized information about people. And first we have started with athletes, so we gather physical data and we also perform genetic tests where we combine both of the things and give you a performance tracking system. And in that case, we have seen that most of the athletes, when they train in order their genetics and their personal data, they show a high amount of increase in their performance. And we have done it with other kind of diseases, like we have done it with, like we had a hackathon, and we gathered some data, for example, your genetic data and your physical data, your blood type, your age, your height and weight, that kind of data. And when we have that data into machine learning system, we have seen that the precision increases from 80% up to 95%. So we can use that data for illnesses, and we have started with wellness, but we know that when we have that data, but the most important thing is the data, whenever you have that, you have a lot of NAs, you don't have really good data, so you have to process it better. That's our aim for now, to process it better and to give a better result for the people. And then we can take into wellness and health, combine these things together with Uniqgene.
Fortunately, many roads lead to Rome. And there is a place for many strategies, for many ideas, and I'm sure on this panel we only represent a few of those. But one thing is sure, science will be able to do a lot, but I think also education and awareness is going to do a lot for the general public. And it starts, in my opinion, by giving access to knowledge and education to women, and especially in civilizations where this is not guaranteed enough. And by this, these mothers will also transmit this awareness to their children. And I think that being patient and not wanting everything to happen in the next 5 years, and this is, I'm referring to 2030, this is wishful thinking. This will take generations to shift, because we need a paradigm shift in thinking, not only in doing. And
I
this
think
is
that's
going
a
to go through
very,
education.
sorry to cut you off, I think you've really hit the nail on the head there, but I want to give everyone on the panel just very quickly, but that's amazing.
Yeah, sure. So for me, especially for skin health, it's a very interesting topic, and we have so much to do. As I said in the beginning, we started with new technologies, and we were able, with computer vision or AI, to scan the face and to say directly what your skin needs. But I believe that we need to be more holistic, and that we need to go deeper in this, and to be able, with our strategy in 2023, to target other aspects of our health, and thus be able to customize all the wellness journey for our customers, not only the skin, but also nutrients or any other kind of service or device related to their wellness. And I think also that we will be able, especially with data, this is the point that we were discussing, to shape the products of the future. And this is very interesting for businesses and for customers.
I think it's very exciting.
And to be able, like for you, I can tomorrow say, okay, I'm gonna make a product only for you. It's your product, and you can have it in one day. And this is actually what we're targeting, and we can go for it, and like, this is very interesting. Yeah.
And as we know, with the buying habits of consumers, there was a recent survey from I can't remember what company, something, and they actually found that even post-pandemic, and we're in the midst of this cost of living crisis, people are still spending on personalized wellness products. So if you're a company, if you're a product-based or service-based company, you would do well to personalize your products, because consumers are finding that it's essential. Their wellness is as essential as household groceries to them. So you would do well to tap into that. So finally, Rob and Thiviyah.
I'll keep it short, given the time. The most important strategy for me is networking with people, because there's so many great people in the room. Everyone has something else to offer, and the opportunity really lies in exchanging thoughts, exchanging ideas, looking into collaborations, and that's what I'll be focusing on in 2023.
Oh, thank you for keeping that very concise.
I guess for me, the most important element that I would say to create a personalized journey is to have the really human element, the human element to it, because to help individuals through their journey, I think it is important to help them feel empowered through what you can offer. And the second thing, I have two things. Second thing is to have choices. I think choices are so important, and so we are doing such great work offering a lot of choices to a lot of people in the world and giving access to them digitally. And with that, I think we can actually do a lot in creating like personalized wellness journeys for, I guess, the whole world.
Well, it's a grand mission, but thank you all for listening and engaging. I don't know if we're taking questions. I'm looking for our lovely host. if we have time for questions, that would be great. But if not,
Yeah, we actually extended so that you guys had the opportunity to engage in some questions. We're going to push the next panel after lunch and start actually promptly, so we have time. Hate to rush you guys. I do know there's a lot of great, valuable information. So I do invite you to go up to the mic in the middle of the room. If you have something that was really interesting that you want to engage our panelists, please do. I invite you to stand up to this stage, that mic right there in the middle of the room. Don't run all at the same time. Look at all these people running. What can I say? Continue your conversation, though. I think you guys were on a roll. You know, I want to really feel that you guys got what you needed out of this panel discussion.
well, you know, if I think sometimes people have got questions, but the effort of walking there, I know you want us to take the 10,000 steps, but feel free to connect with us later. I think the final question that I had is, we've talked a lot about access, and we've talked a lot about making things equitable, but how reasonable do you think it is to make, to be able to balance that kind of economic structure with making things fair and equitable to all, and personalizing and tailoring individual strategies for a populace?
So, yeah. In my opinion, so I'm Tunisian. I am Arab, and I know how much we need solutions, especially in my field, in skincare, within the MENA region. And I think also there is something really interesting we're talking about, is that people within MENA region always think that you need to buy international products, which are really expensive, and you cannot have everyone buying those products. So basically, I think that we need to change our business models and go for educating people regarding their local businesses, local products, and promote those people also, in order to give tips, advices, and alternatives, as specifically when you have a very tight budget. And I think this is something that we work on by saying and changing this way of thinking about local products. And it's not because it's cheaper or it's locally made that it's not good. And I think it's part of also of our journey to impact positively local businesses and local economy, and go with the new generations and all this economic crisis we are facing now. And I think it can be a very interesting solution as well.
Yeah, I guess I agree with you, and this is a challenge I faced when I was working in America versus coming back to Singapore. The ideas of what is good for your mental health, the ideas of what is good for your wellness journey, it differs country to country, it differs population to population. So adding on to that is that locally addressing what the needs of the population are is very important, and it will be also, I guess, cost efficient in that sense to target, the right population for your product and just work at it and give them the best, rather than trying to, spread out internationally, globally. It's not a bad thing, but I think it gets complicated, complex, very expensive in that manner. So if you can do it well, with one targeted population, we can always go further with that, and we can have many entrepreneurs doing that for various populations. Yeah.
I believe that one of the main goals of ours should be to give the power back to the patient, give the power back to the individual, and put them in a situation with knowledge and information and correct information to say no, to disobey to large, powerful economical groups and governments that, for the sake of the general well-being of people, push down health politics and force people to do something which they know it's not really good for them. And experienced this in the last 2 years. I won't go into more on that subject.
I guess I'm sorry, I just wanted to add on. I guess the pandemic has taught everyone to almost just like pause and listen to yourself, to listen to your needs. So I think this is what we have to be grateful for with the pandemic, that, you know, everyone is forced to listen to what they need. And this is where we are also feeling a lot more empowered to be able to make choices for ourselves on what we need, creating that personalized wellness journey for ourselves. And so I think we are here to also guide, just serve as guides. We are not, you know, trying to change people's lives. We are acting as the guides that people need.
I have one question. Why does nobody even think about teaching a mother to breastfeed her child? Because it's normal. So why does anyone have or take the power to teach people what to do for their own health? We all know what we need to do. We just don't do it.
You know what, I completely agree with you on that. Especially, I suppose, going on my own personal journey, you know, they say doctors do make the worst patients. And, you know, a lot of times, I know I'm speaking about burnout and stress and that overwhelm cycle. I would say to patients, you know, you need to take a break, you need to do this. Was I doing it? Not really, but, you know, you need sometimes permission to rest. You need permission to do certain things, to feel like, get that shift in your mind that actually it's okay. And I think that's where we step in as leaders, is to give consumers the options, give them the choices, and help them feel empowered to make decisions on their own, rather than, as I said before, the old kind of model of like paternalistic healthcare, and this is being directed, and this is the choice that I have given you. This is what you're doing. This is the medication you're taking. It's more like, these are the options. Let's collaborate and find a solution that really works for you. And going back to basics, as you said, sleep more, get adequate sleep, take rest. There's 7 different types of rest, and most of us only get about 2 to 3 because we don't know, we're not informed, we don't know, where do you find this information? So I think that is us. Rather than rambling on, feel free to connect with us afterwards. And yes, it's been really great to connect with you guys. All right.
Amazing. Give him a round of applause. Stay right there. Don't go anywhere. I see everyone ran up to the microphone to ask questions. I got the microphone so I can move around a little bit. For any of you people that don't want to take any steps today, anyone have in the crowd want me to come over with the microphone? Great. That sounds fantastic. Okay, that's all right. We're going to keep this engaging as we go. I want to make sure that you guys all can be found easily, right? So which platform do you like to use?
I use TikTok and Instagram.
TikTok and Instagram, that's where you can find her. All right, anyone find her, let me know, because this is an opportunity for us to connect and make sure that we can connect to some of these great industry experts. Which platform do you like to be found?
LinkedIn and maybe Instagram.
LinkedIn.
Follow Uniqgene and Yasemin. Okay.
Grab that mic so everyone
Okay.
can hear you.
So from LinkedIn, you can follow Uniqgene and follow me, Yasemin, UK, but it's spelled differently, UK, and also from Instagram, and you can ask your questions because, you know, like, it's personalized session.
Yeah.
So you have to ask personal questions and about our companies. Thank you for that.
Absolutely, but I want to make sure that everyone's engaging. So find them online, raise your hand. I just want to see if you found their profile so we can make sure everyone can find you easily while we're connecting. And you, sir, where can we find you easily?
Building on my statement about the sucker at the poker table, I'm only on LinkedIn.
At the poker table? No, I'm kidding. On LinkedIn. Okay, LinkedIn, probably found by name. That's probably the best way to do it. I saw a hand back here, so I'm coming to you. Exactly, we're trying to find you on Instagram. What's your handle? How do you spell it? Grab that microphone, honey, so we could hear you.
UNIQ.
UNIQ.
ENE. We have Uniqgene and Uniqgene.global.
Find her? All right, doctor, we're looking for you now. Everyone's looking. All the phones are
I'm
up.
on LinkedIn as well, but I tend to prefer TikTok and Instagram, as that's where I'm really trying to make an impact. But you can find me Dr. Noreen, Noreen, last name Nguru, Nguru. And if you type in www.whatthedoctorrecommends, I have all of my socials and ways to connect.
That's okay. Anyone find her on LinkedIn? Raise your hand if you found her. I know sometimes it's difficult. There's too many platforms. There's too many ways. I always say LinkedIn's great because that's a professional way. You can send everyone to all the other places that you love to use, especially if you're dancing, or whatever you like to do on those TikTok platforms and
like
things.
health education, and you're like,
of course,
I love it.
to the younger demographic. You're on LinkedIn, right? You're on, which one are you on?
LinkedIn.
LinkedIn,
Yeah.
Okay. And how do we find you? You got the name in the book. The book says everyone's name on these panels, so really easy to find people on LinkedIn, right? All you have to say is, saw you on the panel. It was amazing. Let's connect, right? Some of these profiles are locked down, so you have an opportunity to get this access to these people on the panel. Thank you. And sir, where are you found?
I haven't received a letter in a while, so if anyone wants to write.
Anyone wants a piece of paper? Anyone writing letters still these days? No, a text message?
I'm very old school, so email is best. Just find our company, Biolytica, and then click on contact, and then that will be forwarded to me.
Great. So your domain name, your website, and that's
Biolytica.com.
great. You got it. All right. And last but not least,
I guess LinkedIn is the best way to find me. Thiviyah Raman, THIVIYAHRAMAN.
okay, fantastic. I see everyone on their platform, their technical device. How many people in the room connected with some of the panelists today, just now, as we're doing this? 1, 2, nobody wants to raise their hand. 1, 2, 3, 4, 5. Okay, what happened to the rest of you guys? They going too fast? Maybe the word's too fast, huh? You don't have your phone? It's fine. But anyway, the idea is that we connect with all of you so that you never know where tomorrow brings with our connections. And it's about collaboration at Health 2.0. You have been a great panelist. Give them up. Give them a round of applause. Thank you so much. Great, great conversation about personalization. You can put the mics here. We are going to just take one photo of the team. Okay, right here. The paparazzi doesn't go far. Thank you very much. All right, great. Having fun here at Health 2.0 Winter Edition, lining up, getting those pictures. This is great. I'm telling you, you are who Google says you are. If you have not searched your name in Google, what are you waiting for? Search it. You know why? Because anyone that doesn't know you is searching Google when they go to meet you. And if you have pictures of yourself on stage during panels, photos of pictures during the recognition awards, this is a great way to build credibility with new people that are not yet your connections. So it's so simple to do. And as I tell people quite regularly, please do take a moment, take pictures of people during content. Thank you, everyone. You've done a great job. And post on your LinkedIn, say this was great. And if you didn't want to ask a question today, you can post it on digital media and basically pose that question for the engagement from people around your connections, right? And see how you trigger those conversations for people to jump into the conversations we're having here today at Health 2.0. How you doing, okay? All right, great. Anyone getting hungry? Nobody? Getting hungry? I'm trying to sell lunch. No, you know you're going to go down there and everyone's going to get a little hungry. Quiet crowd. I don't know. What should I do? Get everyone jumping up and down? You ever see Tony Robbins? We need a TikTok video in the room? Is that what you're proposing? All right. Do you have TikTok? Me neither. That's why I was like, I don't even know what they're doing over there. I got to, we're getting up there in age. Geez, I like that first panel, all about older age and what do they do. We're going to be up there soon. But I would like to keep the energy up. You hear my voice is quite high-pitched. People go, oh yeah, great, you have energy. I'm trying to keep people alive. This is a Health 2.0. We don't want to die in here, do we? No, that would be bad. We got to keep them alive. That's what everyone's in the room doing, keeping them alive, keeping the planet safe, and working together, right? So how do I get you a little bit more alive? What do you think? What should I do?
Pardon?
To keep everyone a little bit more alive here. We got any injections of anything maybe you can offer? Exactly? Music. Oh, okay, someone likes to dance. Okay, we're gonna get people up, moving around. I see you looking at your phones. I wanna make sure you're connecting. So let's find out. Thanks for contributing. Who are you? Do you mind introducing yourself? I like to go into the audience, find out who's in my audience. Who are you and what's the value you bring to the table, okay?
I'm Dr. Sarah Mandelawi. I'm the medical director at James Barsha National School and a general physician, co-founder of telemedicine clinic in University of Sharjah as well.
Wow, that was a long one. Flows. That flowed really good. Okay, so she's working in Sharjah, she's working locally. I know there's a lot of people from all over the globe. First time in Dubai, first time in the UAE. She's gonna have the information that you can imagine. She won a nice recognition award yesterday, right? And it was amazing to have her here. Great connection. What are you looking to get from this event?
Connections for sure, get to know more people. I am in a room with very well experienced people and leaders, and I aspire to be a great leader as well. So connections and to learn more about various topics, health related topics, and yeah, that's it.
You on LinkedIn?
Yes, I'm on LinkedIn, Sarah Mandelawi, you can find me there. I'll be a speaker tomorrow and award honoree today as well. So you can find me on LinkedIn everywhere. On Instagram, but LinkedIn is the more professional one.
Great. If you didn't hear that, you see what she's wearing today. You can find her during networking or even sit next to her during lunch, because we're going to take that break for lunch. Yesterday we got a big group picture of everybody of all 6 conferences, and we're going to try it again to make sure we don't miss anybody that's here, that came today and missed day 1. So I'm going to say thank you so much from the bottom of my heart for joining me at Health 2.0, Day 2, Morning Edition. We're breaking for lunch, and we're going to get back here at 1:15 to start the panel that we had to push till after lunch, okay? So I'll see you guys. We're going to walk out to the left, down the escalator, and get ready for that big group shot. Once that's posted, you tag yourself, let people know you're here. It's great to be here, Intercontinental Dubai. Thank you for joining us. I'll see you downstairs for a beautiful lunch, a beautiful buffet. Health 2.0. Hashtag Health2Conf. Don't forget it while you're out photographing with all these new connections. Thanks, guys.